studio by Dr. Ernest Enema Parry. Doc.
Good afternoon.
Afternoon. You're out of breath. Tell us just quickly, where do you come from?
I'm an Equiapim from Ebri.
Ebri?
Yeah.
Oh, just here. Right. And what's the Equiapim name or term for enema?
Oh,
in tree, don't look at your phone. The phone has nothing to do with Ghana month. But in tree, I know esa edru, right?
Yeah.
For the enema itself, right?
Yeah.
What about Equiapim?
To be honest, maybe the listeners will help us this afternoon. I'm ready to have an Equiapim. I don't think it's too different.
You are here in Accra chasing Gan Kenke. But you're most welcome.
Thank you very much.
Right,
Good afternoon to our listeners.
Right, common in presentation in both clinical and, let me say, community settings. Yeah. The use of enemas. And I believe I'm trying to get Dr. Usu Setre and Dr. Techi. Dr. Techi is a consultant gastroenterologist and also hepatologist, right? He heads a GI clinic and unit in Kolebu Teaching Hospital. And of course, because it is commonly used and practiced on children, I have Dr. Frank Usu Setre. Frank, can you hear me?
I can hear you loud and clear, Nortey.
Right. What do I say? Akwaba.
Yeah.
Welcome to our Ghana Month edition. Last year, around this time, we had you and we spoke about bedwetting, right? And we're swinging to something also quite common, the use of enemas. And where do you come from? I really also say it's Ashanti. Or
yes, from Ashanti.
Where do you come from? Exactly.
Mampong, Ashanti.
Mampong. So am I right in saying Esa Edru? Ana asa
yes. Yebesao.
Yebesao.
Yes. Right. It should evoke some fear when you hear that.
Okay. Commonly also
whatever you're doing, you stop.
You stop because they are going to deal with you.
Oh yeah.
Okay. Right. So let's come to terms with what we're talking about. When we talk of an enema and the administration of an enema, what are we talking about?
Oh, I'm not very certain it's directed at me.
Yes, it's directed at you, Frank.
Oh, okay, all right, yes. So basically, people use all sorts of things to try to induce one to pass stools, and we have what we call the suppositories, where they prepare herbal things or sometimes some medication that they put through the anus.
Okay.
And that in itself is going to stimulate the anus so that you pass through. But when we say enema, in its broader sense, it is sometimes they use a lot of liquid, some herbal preparations, spices, things that are supposed to irritate the guts.
Right.
And by sheer volume of it, it's able to irritate the gut to cause one to pass a lot of stool. So when we say enema in short, that is basically what we mean.
Okay. So we're talking about the rectal injection of fluids, right? Which may contain various other components in order to stimulate or trigger some bowel movements and then the evacuation of feces, essentially.
Yes.
Okay. And, I was playing that Bruce piece because I've traced it all the way back to ancient Egypt, where we are supposed to be able to trace the Ghanaian state, right, in many senses and many write-ups, literary write-ups and historical write-ups. And then also to very, very many ancient practices. How old is this, if we can link what we do in our part of the world and its prevalence to this kind of history or antecedent?
It is very old. Like you said, civilization, as they say, started somewhere in Egypt. So if you look at the Egyptian records, as far back about 3,500 and even more, we have records that people were using enemas. So this is not a habit or a form of a practice that just started maybe with our generation or with those ahead of us. It is something that has been there, and it's got its uses and it's got its abuses as well. I believe we'll look at that, but it is not a new phenomenon. Something that has been going on for years.
Okay, if you just right. Okay, thank you, Dr. Frank Osusetre of the Kolebu Teaching Hospital. He is a consultant pediatrician and head of the Rebecca Kufuado pediatric ICU at the Kolebu Teaching Hospital. Very commonly used on children. I'm sure many of you can identify with being lined up, whether it's a compound house or not, and being treated and discharged. Typically by mothers, older aunties, and grandmothers. They were the administrators of this whole Bentua regime. Let me know what it's called in your part of Ghana as we discuss its medical relevance, if any. Let me play the neutral role here, if any, and also its prevalence. You just heard speaking Dr. Frank Osusetre. Dr. Enim Apare, yes. You know, I pounced on you with the questions, but this is quite common.
Yes.
I've read research and some other documents that suggest in various parts of the world and in various parts of Africa, in some samples over 80%, others around 60, hovering to 70, and even amongst educated mothers post-secondary, still, should I say, employ or harness this method. You in family medicine, do you hear all these things, and do you get presentations related to the administration of enema?
Yes, so once again, good afternoon and thank you for the opportunity. Like you said earlier on, I presume the prevalence may be much higher than we think it is.
Okay.
Especially working in the primary care setting, you'd have some people walking with all sorts of complaints, and this may be associated or as an impact or a side effect of using enemas. In fact, in literature, to start with, it's quite difficult to estimate the actual prevalence, because if you are working in the hospital setting, notwithstanding that it's a primary health care setting, people will only come to the hospital
when there's a complication.
Exactly.
Right.
So it could be used as an estimate, but really it's not the actual prevalence on the grounds. So off the top of my head, like you said earlier on, I think it's out of the people, I've seen just one adult and maybe a couple more children, but that is in no way to say it is not prevalent in our society. I agree with you that it's much more prevalent in our society than we see in the hospitals. Okay,
so even as we celebrate 66 years post-independence, this is quite commonly prevalent. And Dr. Osusetre, you're at a pediatric ICU. I don't want us to jump to complications yet, but in terms of presentations related to the use of enemas, how common is it?
We tend to see complications of enemas. I mean, it's a practice that is widely done in the communities, and then a lot of it go unnoticed. We get to see, especially either in the emergency room, in a tertiary center, or the pediatric intensive care, after complications have arisen. The commonest complication that we tend to see, enema colitis with perforation. So when it gets to that stage, then we get to see. But I do believe that a lot more people may present with different presentations at the peripheries or the peripheral hospitals that may not get to be referred to as, maybe because it is not deemed to be serious enough.
Okay.
Yeah.
Okay, right. But let's look at the reasons, interesting reasons that I've been able to unearth. I've even seen reasons related to hernias, fertility, constipation, cleansing, and so on and so forth. Typically, what are the reasons for which in our parts of the world, people, let me use the term, home administer enemas? I know there's proper legitimate medical administration of enemas, but let's look at the reasons typically given or proffered for administering these things at home, and then we'll look at the procedure and the implements or tools used, commonly the bulb syringe. Before, we learned that it could be administered using the gourd shaped fruit of the plant, the bentua itself, right? That's where the name comes from. But typically, people are now using or employing the bulb syringe. So, what are the reasons, Dr. Osusetre, that you've come across? I see that we've been joined by Dr. Kenneth Techi as well. I'll just get your response and then swing to him.
Yes, and I want to put on record that Ken is my boss, so in every aspect. So I love my hat, Ken. Yeah.
All right.
So in terms of reasons, some mostly traditional. A lot of people think that there is no reason why a child should go a day without moving the bowel. So if you look at when babies are born, we have the experts, grandmothers who come to bathe the child, as it were. And it is not unusual to see them instilling either lukewarm water or so into the anus so that it is stimulated and then they pass to. And I think a lot of the time they don't understand the physiology that once you go stimulating, something will move. So once they do that and it comes out, then it is deemed to mean that the child is constipated. And hence it becomes a daily ritual. As you know, children, when they are born, they go through stages. Most of the time when they start breastfeeding, they have what you call the gastrocolic reflex. Every time they feed, they pass to.
Right.
And then, because human beings don't do that, every time you eat, then you have to do the other one. So the body matures, because in line with our social norms, social and cultural norms, and we develop our bowel habits, So if you take about 10 or 15 people, they may have different bowel habits. Somebody may want to do it once a day. Somebody may do it twice a day or 3 times, or they may do it once a week or once in 2 weeks. And that is normal. And this is something that we develop as we go along. Unfortunately, it hasn't gone down well to a lot of people that people are different and they need to move their bowel at different times. So most of the time, because you are deemed to be constipated, you'll be given the medication. And I am trying to restrict myself to children,
Okay.
For the others, it tends to be used, maybe a child goes to pass gas at the wrong place. And of course, it offends the delicate nasal passages of adults. And the interpretation is that your tummy, as it were, is rotten. So it needs to be cleansed. And then they have to prepare all these concoctions and use it. Sometimes they also use it as punishment, where you do something bad. Like I said, in those days, I remember they will say, if you don't do it, you don't eat. And of course, the stubborn ones like myself will say, okay, then I won't eat until I start getting hungry. And you go and beg them to zap you so that you can go and do your thing and then get a food. So sometimes they use it, you do wrong things, just one shot at you.
So sometimes it's punitive. Sometimes
yes.
too, it's supposed to trigger or facilitate or promote your appetite for you to be able to eat well.
Precisely.
Okay. Did I hear you?
They also say
yes.
that, let's say you have some rash, and the interpretation is that the rash is a manifestation of something going on within the intestines. So we need to clean. Once the rash is out there, then it means there's a lot more within that needs to come out. And so
okay.
they will give the enema.
Okay.
But that said, there are some children that are also, they have certain conditions that they require frequent enemas in order for them to be able to move their bowel.
Okay.
So sometimes you may see those children also going through that.
Right. Dr. Osusetre, let me just ask you, did I hear you say that sometimes because you want to eat as a child, you'd go and request to be zapped?
No. I mean, the thing is that every weekend, it was a ritual that you have to be zapped before you eat. And troublesome ones like I was saying, we won't go for it. And then they say, okay, you don't come for it, you won't eat.
Oh, so now you have to receive it as a condition.
Football, you do whatever you do. And then when you start feeling the hunger, you go and beg them that, okay, I think I'm ready for it, And then they do it. So that becomes a prerequisite for.
Right. So you're hearing from Dr. Franco Osusetre, consultant pediatrician. I don't know whether to say a proud victim of of the use of enemas, but that's what I'm discussing on Ultimate Health today as part of our Ghana Month. We're looking at the prevalence, the beliefs supporting and sustaining this practice. You just heard Dr. Frank Osuseche, consultant pediatrician, head of the Rebecca Akufo-Addo Pediatric ICU at Kolebu Teaching Hospital. I have also on Zoom Dr. Kenneth Techi. He's a consultant gastroenterologist and hepatologist. He deals with the intestines and all the plumbing in there, and also the liver. Doc, you're most welcome, and thanks for joining us.
Thank you, Nortey. Thanks for having me.
Right, I'm glad you could make it. You are the head, the boss of our GI or gastroenterology department or unit in Kolebu. But let's start with traditionally. Where do you come from?
I come from Kando in the Volta region.
Oh, really?
I'm born and bred in Accra. Yes.
Oh, I've been trying to get the Ewe name and all that. Kando. So apart from Kenneth and Techi, what Ewe name do you bear?
Yeah, but it's not Techi. It's actually Tachi.
Tachi?
It's been zapped.
It's been zapped. Dr. Kenneth Yao. Is it Y-A-O or Y-A-W? Y-A-O, right?
Y-A-W. Y-A-W.
Why is it Y-A-W?
It's not my official name, so I really don't know the spelling, but I think I'll go with Y-A-W.
Right. Okay. All right. So, Dr. Yao, Tachi? F1. Oh, very good. That's as far as it goes for me. But coming back to the intestines and internal medicine or plumbing, right? How prevalent is this? And I'm so glad I've been able to draw you into this discussion. How prevalent is this practice of administering through the rectum, right, fluids, and we'll come to what they bear or what they contain, for medical and other reasons? How prevalent is it? I've tried to screen through the literature, but from your standpoint, expert standpoint, how prevalent is it?
Yes, thank you very much, Nortey. I would say this was a very prevalent occurrence a few years ago, and I'm sure, like Frank narrated, many of us have gone through this in the past. And indeed, there is some historical background to this. So the person we consider as the father of medicine, Hippocrates, many years ago, said that all diseases originate in the gut. And therefore, anytime anybody was unwell, the conclusion was that there was a problem with the gut. And so you had to clear the gut of what we thought was toxins.
Right.
But with time, we have challenged this thinking. That is not to say that we don't believe that diseases originate from the gut. Indeed, it's evident that many diseases still originate from the gut. But it is this form of therapy that we don't believe should be used universally. So to answer your question, yes, it used to be very prevalent. Thanks to modernization and new treatment availability, fewer people are using this as first-line treatment, even at home. Okay. Unfortunately, however, like Frank alluded to, many people still think that you must go every day. And so if you don't go 1 or 2 days, they still would want to if you like, help to eliminate, and so would give an enema.
Okay, Dr. Tachi, with respect, yes, when you say you must go every day, you must move your bowel,
yes,
right?
Yes, people think that you must move your bowel every day.
Go to the toilet or poo-poo every day.
Yes.
Okay.
But that is not true.
Okay.
Indeed, if you don't go in 3 days and you are comfortable, that's fine. Like he said, people vary. Some will go every day, some will go every 4 days, and they are fine.
Right.
And there's no problem with it. But some people also think that in a certain number of weeks or months, you have to detoxify and so eliminate all that has accumulated in the gut. Again, that is also not right. Indeed, what you try to achieve by using an enema would only eliminate some things that you have taken in recent times. For a normal person, within 40 hours, what you take in would come out. Stretch it, in women, to go up to about 100 hours. So that would work for a few days. And so what you achieve with enema is just what you have taken recently. So the gut itself is designed to eliminate itself of these waste products, if you like, every so often.
Okay.
Now, so this is, unfortunately, these are some of the reasons why people are frequently, going for enemas. Medically, however, there are reasons why we may want to use enemas. And thankfully, like I mentioned, for many of these medical reasons, there are alternatives. And so we do not rely on them as we used to do in the past. And some of the reasons we would use enemas are one, yes, of course, if you get constipated and we do not want to use some of the other options, enema is an alternative that can be used. Two, there are some diseases that we treat with enemas, and enemas have been found to be sometimes more effective than other from oral therapies. So, for example, there's a condition called ulcerative colitis, which can affect just the beginning of your large bowel, the rectum.
Okay.
And so instead of taking medicine to go all the way down and act there, we think that just giving something directly to that place can actually, have a better effect. And so we use enemas as part of treatment. When you have to go for certain medical procedures, a colonoscopy, we would have to give an enema to eliminate the bowel quickly so that this procedure can be done. And that is, colonoscopy is like doing, passing a camera to inspect your large bowel. So you need to get rid of this quickly. And so we'll do that.
Okay.
Or you have to go for some investigations like a barium enema where we take x-rays. So we don't want any feces to be in the bowel before we take the x-ray, so we can see exactly the true lining of the bowel. So again, in those situations, we would use enema. So medically, these are some of the few times we would want to use enema.
Okay.
And again, like I mentioned, we don't do this on a regular basis as part of treatment because there are now, modern therapies for treating many diseases rather than giving enemas.
Right. Thank you, Dr. Techi. But let me come in. And obviously, you're speaking as a specialist, a qualified specialist, gastroenterologist. You're not speaking as a mother, a grandmother, or consultant auntie, right, in our indigenous communities. So what you're suggesting to me is that there are clear medical indications or medical reasons why you would want to administer medicine from behind, so to speak, from below, right? Rectally,
yes.
Right?
Yes.
And you specify them. You've talked about cleansing, or a belief and an understanding that it is efficacious or effective in cleansing the bowels or the intestines. You mentioned also that when we use the local or traditional method, it is only able to reach the lowest parts of the system, and it will only evacuate recently taken stuff, right? So are you suggesting that the beliefs that support it, and I've got a list of them, I mean, from hernia and so many other things, evil spirits, impotence, fertility, and all that, are they unfounded? Is it just a belief that you get relief and therefore the relief is associated or triggered by what you used? You seem, and let me just quickly qualify that, because it sounds to me like you're saying typically or properly speaking, this should not be a procedure in the hands of the untrained. Correct me if I'm wrong.
You are absolutely right. I'm hoping that we'll talk about the complications later, but enemas, even though can be effective for certain conditions, they are not indicated or should not be used for some of the other reasons you have mentioned, where impotence, diabetes, strokes, they do not have a direct link as of now. There's no scientific evidence that these are directly linked to the gut, and that enemas or relieving the bowel would lead to any improvement or change in these conditions. So medically these are not recommended.
Okay.
I shall not delve into the realm of the spirit, but I mean, scientifically, we don't have any evidence that these work.
Okay.
And to buttress the point you made, it is very important that when enemas should not be taken lightly because they can have dire consequences. And there have been several reports in literature, even deaths have been reported from, inappropriately administered enemas. And I don't know if you want me to go straight on and list some of the complications that can happen.
I'll come back to you to give us the concerns and the complications that may arise, right? But folks, if you've just joined us, 37 minutes past the hour 2 already, we are delving deep from behind. Yeah, we are exploring the enigma, if I can call it so, of enemas. Rectally administering or injecting fluids into the lower intestines. There are various reasons, there are various indigenous local names and terms for the practice and indeed the concoctions that are injected. In the studio, I have Reverend Dr. Ernest Enema Parry of the Kolebu Polyclinic. He's a family medicine consultant or specialist. I also have a pediatrician or consultant pediatrician, Dr. Frank Owusu-Setre. He writes a lot. Is it in the Mirror? Or yeah. Astom, he's a consultant pediatrician. He's a head of the pediatric ICU at intensive care unit at Kolebu, the Rebecca Akufo-Addo ICU. They also get common presentations and complications. And then you just heard speaking from Bando, Dr. Kenneth Yao Tachi. He's a consultant gastroenterologist and hepatologist. This is the first program I've done where I've not messed up the pronunciation of gastroenterologist and hepatologist. And it always gets me. But he deals with your internal systems, the liver and all that. And he's telling us, suggesting to us that actually this weapon should not be in your hands. Right? Should not be in the hands of over-enthusiastic mothers. Whether it is in terms of preparing you for malaria treatment and all sorts of things. Send us a WhatsApp 055 11 11 997 and we'll see what you say and what you know, especially in your indigenous tongue. I'm going to come to the other part. I've read all sorts of things, including battery acid being part of the concoctions that are injected from behind down below. Let me come to Frank and then come back to Dr. Techi and take a look at this. So maybe I'll start with you, Dr. Techi, since it's your territory. You are the chief plumber in the studio or online. What kind of things are people typically applying and mixing as concoctions? I've read about water leaf, which I believe is boko boko. I've read about bitter leaf. I've read about all sorts of saline or salt solutions and so on. Mixtures of Dettol and soapy water, etc. Doc, am I on the right track? Am I in the wrong? Yeah?
Yes.
Okay.
So the simple mechanism by which enemas work, there are two mechanisms. One, either volume or causing irritation. So if you put a large volume of fluid into the rectum or to the back,
right,
it would definitely stimulate defecation. So you pass stools. Or you put an irritative substance or solution in there. And so this is what people have re-engineered. So mention it. Any pepper, ginger, I'm sure some of us have experienced those before. The more irritative it is, the more potent we believe it is. Okay,
so is that support? That's what the folklore says, that if
that's the myth. And the more irritative, the quicker it works. So in maximum 2 minutes, you would go, and then it means that it worked. Unfortunately, what we do not realize is that the lining of the back passage or the rectum actually can absorb some of the things we put there. If you put acid in there, if you put car battery solution in there, it can be absorbed and become systemic, and that is where some of the complications can arise. Okay. Medically, when we use enemas, we would restrict ourselves to a few things: saline, soapy water, and of course, sometimes when we have, or even tap water, or when you have to use it for certain medicinal purposes,
Right.
then of course there are some medicines, like you can give steroid enemas for specific conditions, or you have to do medical procedures. Then there are these pre-prepared enemas that can, like fleet enemas. Even those, when we use them, we have to be very careful about the volumes we use, because if you overdose, and people think that because it's rectally, there's no calculation to the dose. But no, if you overdose on even the medically prepared enemas,
Right.
it can lead on to complications. So as for what is used by our mothers and locally, I mean, I think that it spans anything, neem trees, cassava, and as much as possible, we try to make it very irritative so
Right.
that we can get fast results.
Okay.
Unfortunately, that is what leads also to many more complications.
Okay, great. 42 minutes past the hour of 2 on Joy 99.7 FM. We're diving deep into this whole enema use. It's getting more complicated, but I guess the more you irritate these lower parts and lower systems and organs, then the more you believe and strengthen the belief that it is efficacious and therefore it does work. Frank, I'm coming to you because typically this is used on children who are helpless, captive victims. These harsh, sometimes toxic substances can cause a lot of complications. Can you share with us, especially with regard or specific regard to children, what are the dangers involved? And I'll come to Ernest in the studio as well.
All right, thank you. So with the children, the commonest that people tend to use is the salt water, the soapy water, of course, with that mindset that we are cleansing the bowel, as it were.
Okay.
Even though you're not going to any medical procedure. A lot of people also use water. And we all remember osmosis and diffusion in school. When you put in water which is deemed to be hypotonic, then it's going to be absorbed into the system, and you can have some toxicities over there. And in addition, the sort of things that are done, they are not done under hygienic conditions. So there's always that risk of infection. And one thing about the gut is that things can actually seep across. So we call it the translocation. So you can have organisms in the gut that will move into places that they are not supposed to go, and cause a lot of issue.
Right.
Then, unlike an adult that can lose a lot of water and still be able to maintain normal function, children become easily dehydrated. So
right.
3-4 large stools, and already they're in trouble. So there really isn't the need for us to do that. So these are some of the things that they use are also corrosive. So right. They burn the gut wall, as Tichi said, and then some of the spices then irritate it so much that they come out with a lot of complications.
Right.
But the most feared complication, which I witnessed recently in the ICU, is a child that in the process of introducing the bulb syringe, the bento as it were, they perforated the gut. So you have feces soiling the places that are not supposed to go within the abdomen. And the surgeons have to go in and try and do their best in order to salvage the situation.
Wow. All right. I'll give my guests on Zoom a break so that I can switch and read, switch my screen and read some of the WhatsApp. But whilst I'm switching screens, if you just joined us, we're talking about the use of enemas, applying fluid often infused with various components to irritate the gut, to cause somebody to move their bowels, to relieve constipation, and many other things. Right? I've got the specialist on my line just heard speaking, pediatric consultant and specialist Dr. Franco Ususetre from Ashanti Mampong. From Kwando, I have Dr. Kenneth Yao. Tachi, consultant gastroenterologist and hepatologist. And in the studio, I have a family medicine consultant also, or specialist, right? Reverend Dr. The Reverend, he says I shouldn't use it too much. He's yet to be laid hands on properly, right? But he's Dr. Enema Parry. I'm just trying to switch to my WhatsApp page. But whilst I'm doing that, Ernest, in the studio, would parents or indeed mothers, the culprits or the typical suspects, usual suspects here, would they actually confess? You know, they might present with a complication, but would they typically give history, or do you have to probe that have you done anything with this child that may be the cause of what we're seeing, the presentation?
Yeah, so like I said earlier, many a time people would go through this may come with mild or no complications, and that's why maybe someone listening to us will say, "Oh, but these doctors, what are these? What do they seem to be talking about? Because you've had this since childhood, and there's not been any such complication as mentioned by Dr. Usu-Setre." But indeed, when some of the complications occur, they may be severe. Many a time at the primary care level, you would have instances where a parent or a guardian or a relative will be able to confide in you from the outset and tell you that this is what has transpired. And again, like I said, sometimes depending on the severity of the situation, it may be self-limiting. That's to say that if it is just some mild abdominal pain with some cramps, you can't give the child some, not just a child, but the patient involved some time and observe. But in very severe cases where there could be a bleed or a perforation where the, the contents of the intestines tend to now seep in the general abdomen, then that's very dire situation.
Leaking feces and other things.
And the severest case that I heard of was one middle-aged man, about 57 or so, who had to be transfused a lot of blood because apart from the perforation, then there was excessive bleeding. So
internal bleeding.
Yes, excessive bleeding. So the person kept on bleeding, and you have to replace the blood loss. So yes, you can have parents who will come in with that complaint from the outset, but sometimes when things are not adding up, you may have to probe because it's not something that they would offer.
We have to follow up and investigate.
Yes,
and
because
probe.
they also think that in any case they may be found culpable. So why then offer that information?
Great stuff. 48 minutes past the hour, 2 on Joy 99.7 FM. We're still deep down there somewhere from behind, right? Exploring, I tried to call it bentology because one of the articles I came upon used that specific phrase, bentology, but really, using the rubber bulb syringe, the bentoa, right? If you have a name for it in your locality, your language, share it with us on WhatsApp 055 11 11 997. Let me read this. Hello, Nortey. I'm learning a lot listening to the program. Welcome home always. Elinam in Adenta. I'm coming, Elinam. I'm coming. What have you cooked? Bonjour. Aside from, hang on, this is Dede in Maryland. Let me take my time and read. Aside from using an enema, I've witnessed a can, mostly ideal milk, empty can with a hole pierced under it, filled with lukewarm water, which is raised, right? You use gravity there, to empty the warm water through the hole on the rectum or into the rectum. It's also done to the penis and vagina as well. All right, I'll put that to my specialists. Please, somebody's asking something to be forwarded to Nortey on Ultimate Health. It's a picture or a video. Make sure you take the purgative shot and run into the bush before leaving for church tomorrow morning. I'm sure it's some video of somebody taking something which probably has some kind of almost instantaneous effect. My phone line is active 0302216541. Any questions on this whole spectrum of bentology? Right, that's what we're talking about. Let me come back to Dr. Yao Techi. Right, I'm not going to use Kenneth anymore. Yeah, coming back, just some of these complications. I read in my research that typically the person should be in a particular position for it to be administered. And not that we are teaching lay persons this position, but my understanding was that if you are lying on your left side or the left lateral side, it gives better access and it's safer and so on. So can you just quickly give us some understanding of this, not training, but understanding?
Yes. So the position in left lateral position is a position in which we actually perform medical procedures on your rectum, or where you are actually, putting the enema.
Okay.
Because that puts your bowel in what we call that in the correct position. And I explained, so that the rectum, when you are lying in that position, we know that it goes towards the back.
Okay.
And so if you're in any other position, we are not certain in which direction your rectum is.
Okay.
Right? So
can I quickly barge in? Sorry, I'm just quickly coming from behind as well. But quickly, so our mothers typically, they place you across the lap.
Right.
Right. Can we relate this traditional medicine or traditional clinical or community clinical practice to what you're saying? When they put you in that position, what are they doing?
When they put you in that position, ideally the tip of the ventral, if you like, or the enema,
the nozzle,
the nozzle should actually be pointing upwards. But you agree with me that when you are seated and you're lying on the lap, the natural thing is to point it downwards.
Oh.
And that is the best position to injure the rectum. So you point it downwards, and the next thing is it's going straight to the anterior, the front part of the rectum. And that is what leads to perforation, especially if you have an aggressive mother, or not an aggressive mother, a gentle mother, but a very restless or uncompromising or uncooperative child.
So stubborn academy like Frank, right?
Exactly.
Okay, and struggling with the mother or the auntie. But Doc, let me capture this properly, because so the positioning is wrong, and the nature of the tool and its manipulation by the mother is likely because of the position and other complications with regard to position to hurt and damage something.
Yes.
Wow.
So if we are aware of the anatomy, then you know that when the child is lying on your lap, then you should come from below and point it upwards, as if towards the mother's face. But oftentimes that is not what is done. Okay, but if you put the child on the left side, then it's very easy to direct it backwards towards the child's back. And that is a safe position to give an enema.
Wow. Right. So we're doing it wrongly, and therefore we are more likely to cause harm.
Yes.
Right.
Yes.
Please continue, please.
As an adult physician, I have seen complications, involving the kidney. So the solution that is used is absorbed into the system, and this causes kidney shutdown. But also there's information, data to show that, people who use enema repeatedly, of course, anytime you use an enema, you injure the cells, the protective cells of the bowel, the lining, bowel lining.
Right.
And repeated replacement predisposes to us, is what starts the process of dysplasia, something that leads on to cancer. So people who use enemas repeatedly, and I'm not talking about using an one-off or occasional enema.
Okay.
But enema is your only means of getting relief every time. So every 2 days you go for it. Every time you do that, you injure the cells, and in the process of replacement, you may not get a normal replacement, and then you get an abnormal cell start showing up, and that can lead.
It could lead to cancer. Thank you, Doc. Let me just quickly take a caller on the line who's been on the line for a bit. Hello, good afternoon. Hello.
Hello.
Yes, sir. Apologies. Who am I speaking to? Where are you calling from? Then quickly your question.
I'm Beku from Dalsama.
Right, Beku. Thanks for waiting. Please share with us.
I've been having some waist pain. I remember about 2-3 years ago, it happened. I went to hospital. I was given an injection. It vanished. But it will come again. I've been to hospital on several occasions. So experience the pain. I've been told that this thing does not have a medicine. The doctors and hospital cannot care. So I should go for a medicine. Almost all the medicine that I've given me, I've used anyone that is bent to this is also what I'm listening this afternoon. I want clear interpretation so that I will not injure myself.
Okay. Right. So, doctors online and in studio, Beku is describing a situation where he has recurrent back or waist pain, right? He's gone all over the place. He's not getting relief. But typically, whatever he's prescribed, he's told or advised to administer it rectally using the bulb syringe. Now, listening to us, he's worried. He's primarily looking for relief for the waste problem, which he's not getting, but he's also administering as he suggests is advised. Let me come back to Dr. Techi and then quickly back into the studio as well. Doc.
Yes, I'm equally worried for him, but his story is not at all. It's not unique to him. There are many people who think that if you have waist pain, then the solution must be in an enema.
Right.
I think what he needs to do is to have a proper evaluation, because the cause of his waist pain may actually be very far away from his rectum.
It's a referred pain, right?
A referred pain, exactly. And so I don't endorse that, and I think that he needs to be reevaluated and given appropriate term.
But it does sound that like he's getting that advice from, in quotes, allegedly, qualified people or people he's seen at the hospital. What would you say to that? In the sense that they are giving him medicine, but he's being told to use the bulb syringe to apply rectally. That's where his concern is coming from. He's not saying that they said using an enema, but he's supposed to administer through that route. What would you say to that specifically?
Unless he has the condition I mentioned earlier, ulcerative colitis, I cannot think of other conditions that you would require you to apply something rectally using the nozzle of an enema syringe. So it's difficult to, but of course there are medicines that are given as suppositories. Those are totally different from enemas.
Yeah.
So I am not too sure if it's confusing the suppositories with enemas, but I can't think of any condition.
Okay.
That would
what I'll do is, Bekun, please call.
Him up.
Yeah.
Yes.
Please call my producer. Let's see if we can patch you through to somebody to guide you through proper assessment for this situation you're talking about. 0302216541. WhatsApp is 05511119997. I'm trying to clean the deck. Doc, in the studio, Ernest. I mean, again, we are hearing these things, and for many reasons, people. I'm wondering, getting this, should I say, insight about the position, and I read about it, and I wanted to bring it up. I'm glad we'll be able to emphasize it. But self-administration of enema sounds very awkward now that we understand this. You are actually, using Frank's word, zapping yourself. Do you get people saying that they did it to themselves?
I've seen one case like that. It was an adult male.
What?
You know, there are different reasons why people do this. First off, I think, as been mentioned early on for doing the introduction, you know, people would have different reasons. And sometimes, like our caller mentioned, the mode of administration has almost been equated to efficacy.
Right.
Like Dr. Techi said, there are instances where particular medications will be given that way to increase absorption and because it acts locally.
Okay.
But sometimes traditionally, or in our, what do I say, in our context, in our various social or traditional context, people are tempted to equate the fact that if you give any medication by enema or through the enema, the effect will be much better or
right.
more efficacious.
Okay.
So I've seen an adult male who did that, but additionally, there seemed to be another reason which we've not mentioned, where people do it to, what do I say, satisfy their sexual craving. So that is another thing.
They get aroused by this whole process.
Do that. So this was an adult male who did it with the intention of a sexual arousal, but unfortunately the thing got stuck. So people do it for different reasons, and I'm happy that you've opened this up so that people get to know the dangers associated with
my
it.
My word. It's almost, it's actually 3 o'clock. But let me take final words from Frank. Are you there?
Yes, I'm here.
Frank, just quick words for mothers, because the children are captive. Adults are listening to us, and they may desist or be transformed by the information we're giving. But for mothers, what do we say? Mothers, grandmothers, and all, you know, who do this almost, in quotes, religiously. What should we be telling them?
I think they should desist. They should desist from that. If there's a medical reason for that, the medical practitioner will give that. The frequent enema is not helping anybody. You know, the bowel has got a milieu, an environment that will have to be maintained. We have some viral, some bacteria, good ones, bad ones. Frequent enema is just clearing the good ones, and then you are prone to overgrowth of the bad one. So there's no reason, and like I said, there's no reason why a child should move the bowel every day.
Right.
If the child will go twice, 3 times, that is fine. If for 3 days before and the child is okay with it, abdomen is not bloated, is not vomited, please allow the child. Thank you.
Okie dokie. Thank you very much, Dr. Frank Owusu-Sekyere, consultant pediatrician with the Pediatric Intensive Care Unit, Kolebu Teaching Hospital, the Rebecca Akufo-Addo Intensive Care Unit. Head of Gastroenterology or consultant gastroenterologist, Dr. Yao Techi.
Yes.
What would you say, though we would want to make time maybe next week to look at the specific complications and then other internal matters with you, but what would you say to listeners? I've tagged this alongside our Ghana month as something that we do and we're familiar with, right? Not restricted to Ghana. What are your closing remarks and cautions?
So what I would say is that enemas should not be used routinely, certainly not by inexperienced individuals, and enemas should be a no-no if there is an acute constipation and or if there's suspected obstruction to the bowel. So if you're not passing, if you're having difficulty to pass suddenly, an enema should not be considered. Thank you.
Right, Dr. Okay, let me bring back the Kenneth. Many of you know him as Kenneth. Kenneth Yao Techi from Kwando, head of the GI unit or department, Kolebu Teaching Hospital. We had also Dr. Frank Owusu-Sekyere in the studio from just, up the road, where Lexus has been walking plenty. Dr. Ernest Enema Pare, specialist in family medicine. We'll take a look at the complications. There are other things deep in there that we fiddle with, whether on the basis of tradition or just out of ignorance. But I hope you have been informed and you have been transformed. To my producer, Abeku, who I know is from Ewutu somewhere. Do you know any of the things we're talking about? He says, I. Ewutu break room. Breku. Yeah. Just down the road as well. To him, I say, Inga, Oyradon. And to you, my listeners, Yeradon, next week, what should I say? Hoba. I'm out. Bye.
The station.